when their surgery's over, they will say that, you know, when I got those Vicodin, the craving for the Vicodin was far worse than any pain I was experiencing. And I'm so glad I got off it. It was a horrible experience. So what can you use? These are some things that your doctor would be okay for you to use. Motrin, naproxen, which is Aleve, Toradol, which is a very powerful non-steroidal anti-inflammatory, Tylenol, ice, rest. These are things that we think, well, definitely the answer for something wrong is a pill, right? The people who are absolutely convinced that the answer to all their problems is a chemical, that's the addict group. It's hard to talk to them and tell them that you don't need tons of pills. You can do other things like put ice on it. It actually works to control pain and swelling. If a person has chronic pain, I specialize in prescribing a medication called buprenorphine, which is in Suboxone. It is not, I wouldn't say, the safest thing in the world for people in addiction, but when you talk about comparing it to an opiate for long-term chronic pain management, I'd say it's far better. So there's a group of people who've been in recovery. They all raise their hands. Who recalls being anxious early on in recovery? A little bit? Yeah. I'd say it's fairly universal. It's just part of getting from this coping skill system that used drugs and alcohol for years and years to having no skills and dealing with the rest of the world, and you feel anxious. And so if you end up in a doctor's office before talking to your sponsor, you're going to end up getting medication. Talking with someone who's an addiction specialist in that situation, if you need help, could be really helpful, because in most cases, most doctors will reflexively write a sedative, like Xanax or Klonopin. Well, Xanax is real addictive, but Klonopin's fine. This is not true. They're all very problematic. Okay, and for those people who are in recovery, who has more than a year? Anyone have more than a year? Would you say your anxiety levels have gone down? Raise your hand if your anxiety levels have gone. Most of you, okay. It takes some time. Sometimes a year, sometimes 2 years, sometimes 5 years. But anxiety does go away. It doesn't get better with sedatives. It will temporarily, but it will be far worse when you're done. However, that being said, even though it was almost universal, all the people felt anxiety, there's probably 2 to 5%, maybe a little bit more, maybe a little less, of people, just like the rest of the population, who have an anxiety disorder, a real problem with anxiety where they cannot ever get over it unless they get some form of treatment. Those people should see an addiction psychiatrist to get on a medication that could help them, but not activate their addiction. Brilliant idea, but you got to get there. You have to know that it's out there. So and this just points out that there are